So fast.
Come in.
Hello, my name is Jacqueline. I'm going to be your nurse today for about the next 15 minutes. I'm going to do a quick head-to-toe assessment just to see how everything's going, and the doctor's going to be coming in. I performed hand hygiene. I've checked the area, and it's safe. And I just want to thank you for letting me be your nurse today.
Yes.
Okay, I've checked the bed rails. It's up. The bed's in the highest position. The thing is locked. The call light is within reach. Can I see your wristband, please? Can you tell me your name
Jamie Carson,
and your date of birth?
2/20/02.
Alright, awesome. And that is correct. I'm checking her body for any drains, tubes, and dressings. She has an IV. I check it up to the flow pump. It is going at the normal rate of what the doctor ordered, so she is good. I'm checking really quick to see her oxygen saturation. And her oxygen saturation is at 98%, and she's on room air, so she is doing good. I've checked her general appearance, and she is clean and well groomed, and so she is normal there. And she was joking with family and in good spirits before, so she's doing good there as well. Alright. After that, I'm just gonna, can I pinch your collarbone really quick? I'm just gonna do that. Just because while I'm here, it's easiest for me to do that. I'm just pinching it. Your skin trigger is normal. And I'm just assessing your skin as I go. Just always making sure that there's no redness or things like that. And as I go, I will be checking her bony protuberances just to see if there's any issues for maybe things being rubbed wrong and pressure ulcers and things like that. But so far, so good. There has been nothing. Check that, check that, check that. Okay, next I'm going to be taking her vitals really quick. And so I'm just going to first assess her temperature. This is my fake temperature stick. I have rubbed it across her forehead. It says 98. We're good. Next I'm going to be taking her pulse really quick. I'm just going to look at here. I'm going to be taking it for 1 minute starting now. As I take her pulse, I'm going to be checking her rate and rhythm of her chest rise and fall. Just making sure it's normal. And as well as checking the overall thing of that. Alright, blood pressure, the pulse is normal. It was about 80 beats per minute. And next I'm going to be taking her blood pressure, so I'm taking the cuff and making sure the artery is lined up correctly with that. Can you sit up, please? Normally I'd have a table to put this blood pressure cuff on. However, today I don't, because this isn't a clinical setting. So I'm just having it rested on my leg. I would not do this with a normal patient. But because we're cousins, I think we're safe. Okay. Okay, it's at about 118/78. She's good, blood pressure wise. Next, we're going to do a quick pain assessment. Are you in any pain at this time?
I have a headache.
Oh, I'm so sorry to hear that. On a scale of 1 to 10, 10 being the worst pain you've ever felt in your life, what would you say your headache is?
7.
I'd say it's a 7. Alright, where's it located at?
On my forehead.
Alright, and does it radiate away from your forehead at all?
No.
Alright. What makes your headache better?
Peppermint oil.
What makes it worse?
Bright light and loud sounds.
Okay. And have you ever had a headache like this before?
Yes.
Alrighty. And do you know why you may be having a headache?
No.
Alright. And so next we're going on to the respiratory assessment. I already assessed her for depth and rate. So we are going to just take a quick listen. Can you sit up, please? Every time I put my chest piece on your chest. Please breathe in and out. There we go. And deep. There we go. Almost there. Good job. Last one. Alrighty. Do you have a cough at this time?
No.
Alright, if she had a cough, I'd ask for the duration as well as she had any sputum. If she had any sputum, I'd be asking for its color and viscosity. At this time, if she had a sphinctometer order, the thing she breathes into, we would be doing that, but she does not, so we're going on to cardiovascular. So I'm just going to take a quick listen to her heart. I'm going to be listening for S1, S2 as well, if there's any heart murmurs, as well as the rate and rhythm. Everything seems good. Next I'm going to be getting her typical pulse. I'm just making sure you can see that I went under. Alright, she's good. Next I'm going to be just quickly checking your capillary refills. One Mississippi, 2, 1 Mississippi 2. Alright, your capillary refills are good. I'm going to be checking for any edema on her arms. She has no edema. And as I'm checking for edema, I'm also checking to see if there are any warmth or things like that within it, just to make sure that it's good there and her limbs are all decent and she's doing well. Okay. Next, I'm going to have her do a quick neurological assessment, so I'm going to make sure that she is oriented × 3. Can you tell me your name?
Jim.
And can you tell me what today's date is?
July 10, 2020.
And where you're at?
Hospital.
Alright, awesome. And can you squeeze both my hands for me? Sweet. Can you push up against? And there we go. Alright. Do you feel my hands touch all 4 limbs?
Yes.
Do you have any tingling or numbness within your limbs?
Nope.
Alright. So I forgot my pen light at home, so this is my fake pen light. Can you sit up, please? I normally would have her take off her glasses. She did. Okay. I'm pretending to flash it here, flash it here, flash it here. I see her pupils dilate. Can you lift the top of this? And back to the wall. And the top of this again. And her pupils accommodate as well to that. So we're good. Okay. After this, we're going to do your gastrointestinal. I'm just going to take a quick look-see. But before that, I'm going to ask her a few questions. Can you sit up, please? Do you have any issues swallowing?
No.
Can you swallow for me, please? Everything seems to be moving well. With your diet, have you had any changes to it recently?
No.
Do you eat a nutritious balanced diet?
Yes.
Do you have any issues with stomach upset or anything like that?
No.
Okay. Do you have any issues with vomiting or have you vomited recently?
Nope.
Alright, I'm going to take a quick look at her stomach. Her stomach is relatively flat and it looks good. I'm going to auscultate the 4 quadrants really quick. 1, 2, 3, 4. Okay, after that I'm going to palpate lightly. As I palpate, please let me know if you feel any pain.
Yes.
When I palpate, I'm trying to feel for any abnormalities. If there's any lumps or bumps I should know about. Everything feels good. When was the last time you had a bowel movement?
Today.
What did it look like?
It's normal brown color and it's normal overall.
Just normal overall?
Yes.
And do you have them regularly?
Yes.
Okay. And do you have any issues with farting? Do you fart too much? Or like, do you fart regularly? Have any issues passing it?
Smell that.
Oh yeah. She has no issues with her flatulence. Do you have any issues with burping or things like that?
Nope.
Alrighty. So next we go into genital urinary. So I'm just gonna ask for that. Do you void or urinate frequently?
Yes.
Okay. Do you feel like you do it more than the average person or normal?
Nope.
Nope,
Normal.
just normal. Okay. And when you pee, do you feel any hesitancy to start your stream because you feel like it might hurt?
No.
Do you feel any burning when you pee?
No.
Do you feel any urgency with your pee?
Nope.
Alrighty. Okay, after that, I'm going to do a quick musculoskeletal assessment. So I'm just going to ask her to get up and go to the door and walk back. So if you can get up and go, please. And I'm checking her gait, just making sure she's not a fall risk, which she's not. Do you use a cane or a walker or anything like that with your walking?
No.
Do Do you feel like any of your life is impeded by your movement? Like if you were to shampoo your hair, your shoulders might hurt, you can't walk well. Alright. And lastly is your skin assessment. As I've been assessing, I have seen no redness or overall skin issues like lesions. I've checked your bony protuberances such as her knees, her elbows, and her tailbone in order to make sure that she has no risk for pressure ulcers or any redness or skin breakdown. Her skin is not moist and it's been well taken care of. And because of her age, I'm not concerned. We are done with the assessment. I wash my hands.